tonight. I know many of you know him, but please indulge me by presenting to you how blessed we are tonight to have one of our most esteemed members of the Kayani Healthy Living Experts Philippines. He is a cardiovascular thoracic surgeon, associate professor, Faculty of Medicine, University of Santo Tomas. He's also a consultant at the UST Hospital. He has been practicing medicine for the last 40 years. He also participated in the first successful heart transplantation procedure in the Philippines, and he is a proponent of functional medicine. Added to all of this, last June, he was elected to the global position, the highest position of chairman and president of Couples for Christ. My dear friends, let's welcome our resource speaker for tonight, Dr. Joe Yamamoto. Okay, let's send him a big clap, everyone. You can, I think you can turn on those claps, diba? There you go. Good evening, Dr. Joe. Please greet our audience.
Hello, Kate. Good evening, and also to our faithful and excited business partners, not only in the Philippines, but in many areas around the world. So I greet you, mabuhay, and a pleasant good evening. So if you are out there in the Bay Area, it's a pleasant day. I'm not too sure about your exact time, but nevertheless, it's not too late to ask you, to tell you, I greet you a happy and pleasant day.
Dr. Joe, I just want to focus on you being elected as the global head for chairman and president of Couples for Christ. You know, this is a very prestigious position, and this happened, remember, on June 25, that day that we featured you in our Bangon Pilipinas Leaders Night segment on Celebrate Leadership. And you really gave such a beautiful, beautiful sharing, no, of your personal thoughts on leadership and values and etc. So, Dr. Joe, how do you feel, being elected to this global position of chairman and president of Couples for Christ over and above all the things that you are doing in the medical field?
I'm overwhelmingly old. I mean, I cannot figure out, how I came out as chairman president. But I guess it's only to realize that nothing happens by accident in God's plan. So I always take it, from divine providence, and to have made it all possible. So at the end of the day, I consider myself just a humble servant, an instrument of God's healing hands.
Wow. That's so nice to hear, no? Such a humble reply from a man of great stature. So tonight, I'd like to request everyone to, as you listen to this conversation we're going to have with Dr. Joe, please post your questions in the Q&A box that you will see on your screen, and please ask questions that are related to the topic of discussion tonight. Dr. Joe, let's now dive deep into the conversation we're going to have. And I'd like to lead with this question. What is the microbiome?
It's a fascinating topic, Kate, because when you talk about the microbiome, it is the sum total. It is the community. I call it the community because it's made up not only of bacteria, yeast, and viruses that live mainly in the gut, but truth of the matter is that it resides on the skin, the surfaces, even in our mouth, and also all over the body. And you will realize that there are many more areas where bacteria are actually located, and you will learn later on about the interaction between good and bad bacteria. So it's the whole community of the microorganisms. And again, if you try to look back historically, it has actually developed a symbiotic relationship between humans and bacteria. By symbiotic, I mean humans derive benefit from bacteria, and bacteria similarly derives benefit from the humans. And so that's why it's called a symbiotic relation. Each one reciprocally benefits from that kind of presence in each one. And then, of course, we consider it nowadays in the light of modern science, researches, and clinical experiences that indeed the microbiome is the control center of the human body. it's not quite like the exclusive domain now of the brain, but because we have the microbiome, and that has become been considered as the control center of the Philippines, without of course diminishing the importance of the brain. But again, just to add up some spice to our discussion tonight, the microbiome, especially the gut microbiome, is considered our second brain. It's called actually the enteric brain, and meaning to say the intestinal located brain. And then if you try to weigh in all the sum total of the bacteria, fungi, and viruses inside our human body, it weighs about 3 to 5 pounds, meaning to say it is twice the size and weight of the brain.
You know, that's very interesting trivia, Dr. Joe, no, when you said that may connection yung gut with the brain, because there is such a thing as I have a gut feel. Meron akong kutob. So, totoo pala yun, Doc, no? Totoo yung feeling na gano'n.
That's really true, Kate. Something that has actually entered into our vocabulary as just an experience. That experience is not really empty, because indeed, if you have a gut feel, you can feel butterflies in your gut. It is indeed because of the interaction between the brain and the bacteria, or the so-called microbiome inside your intestines. No? And again, just to put emphasis on the fact of the matter, we have actually 10 times more cells of bacteria, about 100 trillions in our gut and all the other parts of the body than combining all the cells of the rest of the body. So you can just imagine that we are actually more bacteria than humans, especially if you consider that while we consider ourselves complex, because we have about 23,000 genetic material inherited from our fathers and mothers, and that are found in the human DNA. The DNA being the template, it is the roadmap of our genetic composition. But here, in this slide, you will realize that we have inside of us 100 to 150 times more genes found in the microbiome than the 23,000 genes. So in short, our number of complex genes pales in comparison to the 100 and 150 times more genetic material in the bacteria. So said in another way, while we may have genetic predispositions, the composition, functions, and interaction of those genes in 100 to 150 times present will definitely have an impact on our health, wellness, and illness. So that's the bottom microbiome interactions.
That's very interesting to note, because, we have this perception, kaming mga lay person, no, Dr. Jonah. Basta pag sinabing bacteria ay negative yan, masama yan, no? Pero what I'm gathering now from you is not all bacteria is bad. There is such a thing as good bacteria also, di ba? Which I know you're going to discuss later on, di ba?
Yes, actually, as our session progresses, you will learn more and more and appreciate more and more the power and the benefit of good microbiome. Okay, so the functions of the microbiome are very diverse, but what I did here is just to highlight the important things. So it's already a given. If you talk about intestinal microbiome, it is very important for digestion. So everything that you eat must be acted upon by the bacteria so that it is absorbed, digested, and also utilized. And so you need bacteria to do that. And there's another benefit of the presence of the good bacteria in the intestines, because they manufacture vitamin B12 and vitamin K. What does vitamin B12 do? It actually helps promote the manufacture of red blood cells, and vitamin K is a very important element that controls clotting. Can you imagine bleeding to death if you do not have vitamin K? And we owe that to the presence of the bacteria in our intestines, that you have vitamin K. It is really the clotting mechanism vitamin. And then, of course, we have the other benefit, regulation of metabolism and blood sugar. You realize that why do some people become obese and develop tendency to develop diabetes, whereas others are not. People are eating a lot of carbohydrate, or even probably not even exercising, and yet has remained slim. You always point to the microbiome, the quality, the variety, and also the efficiency of your microbiome, why you are actually healthy or in bad health. So that is part in the function of the microbiome. And then, while we say that we are 23,000 genes in our various cells in the body, but the interplay or the presence of 100 to 150 times more genetic material, it simply tells you whatever we inherit as the good traits or even some of the genetic aberrations or abnormalities does not have to spell out, that kind of destiny of illnesses, because lifestyle, environment, and diet have very important impact. And guess what? Your bacteria, whether it's good or bad bacteria, will have an impact on your genetic expression. So, two distinction: the genetic composition, which is quality, and the genetic expression. So, we are not destined to have an illness if, for example, we have a genetic abnormality. And then, of course, now science has already demonstrated and proven that the microbiome is very important in brain chemistry. And what of the brain chemistry? We have a set of substances called meaning to say brain-derived neurotransmitters. And this is a very powerful interplay of substances and chemicals that are produced by the interactions of bacteria with certain nutrients. And last but not the least in the slide is really constitutes the 70% of our entire immune system is there in the intestines, where again, you can rightfully conclude that the bacteria is really important in making sure that 70% of our entire immune system are performing very well. So if you look at the right side of this slide, you realize that you're actually being protected by your microbiome against pathogens. And pathogens are disease-causing, or these are part of the so-called bad microbiome. And so you realize that good bacteria will necessarily crowd out the bad bacteria, even to the point of promoting the destruction and death of these pathogens, because if you have overwhelming presence of good bacteria, then you are in good shape. Then there is also synthesis of the vitamins, as I've already mentioned, immune system, and promote intestinal angiogenesis. Remember that your intestines are very important, and at the same time, because it's important, it works 24/7. It can easily be damaged by what? Food, toxins, and other chemicals. And then, of course, the other things are, you can see already, modulation of central nervous system, short-chain fatty acid production by the interaction of bacteria with the dietary fiber, and even promotion of fat storage. Very important functions of our microbiome.
I didn't realize that ganito siya kahalaga, no? Lalo na Dr. Joy, yung sinasabi nyo dito about they constitute 70% of the immune system.
Correct.
Diba?
Correct. Yes.
Wow. So we need a strong gut to be able to fight COVID also. Diba?
Oh, yeah. You are entirely correct, Kate. Sometimes it's not the vaccine alone that will protect us from COVID. By ensuring that you have a good immune system and taking care of your gut. This now becomes a gut issue, gut importance. If you have taken the pains of taking care of your microbiome, that actually promotes a resilient immune system.
Thank you, Dr. Joe, for clarifying that. Now, from the functions, let's now go to the factors that can damage the microbiome. Let's take a look at this.
Yeah, actually, it's very important for us to understand that to ensure that you have good microbiome, you have to nurture it. But on the other hand, if you actually violate that balance, then you are probably, without you knowing, that you may actually inducing damage to the microbiome. And so what are these? Many, many common things, many, many common activities that are actually damaging to the microbiome. One is that, well, highly processed food. When we eat a lot of fast food, all those sort of things, because they are highly processed, it is devoid of nutrients. And especially, if these are all factory produced food, they are necessarily or more often than not laden with empty sugar. Empty sugar may be heightening the taste or the palatability, but on the other hand, high sugar promotes ill health. You can anticipate that even obesity may be because of the high sugar. And then high trans fat. Remember that Many of these fast food that we are eating are actually cooked in high temperature. And so the fat that we use, the cooking oil that we use, can become converted to disease-causing trans fat. And last but not the least is that because of the highly processed food, they do not have high fiber content. So they are actually low fiber diet. As a matter of fact, there's a saying that the outcomes of westernized diet, SAD, SAD actually stands in capital letters. It stands for the Standard American Diet. So if you talk about Standard American Diet, if you hear it over and over again, look at the highly processed food, high sugar, high trans fat, and low fiber diet. And so you have a good understanding. And because we are supposedly living in a modern world, we are always about instant gratification, instant relief, instant here, instant there. We want everything at within the reach and within time. That's why we have the cell phones. But on the other hand, together with that progress, for every ill we have a pill. In short, for every symptom that we feel, we expect that there is a corresponding pill. But there is an important downside to it: unrestricted use of antibiotics, and many people may be inadvertently harming themselves because they buy over-the-counter antibiotics. So if it is not strictly indicated, you just take it because you just happen to have a fever or a sore throat. Even if it is viral, you take antibiotics. Ultimately, the antibiotics will not work for your viral infections, but on the other hand, there is a long-term effect, and that it damages your microbiome. Everybody is complaining of GERD. I think everybody knows what I mean by about GERD. So there's a hyperacidity manifestation, feeling that they are bloated. They take what? Acid blockers, the so-called proton pump inhibitors, including antacids. But take note that long-term chronic use of acid blockers will inevitably harm your intestines. And then, of course, all of us, we have a lot of aches and pains, headache, migraine, joint pains, back pains. What do we do? Our go-to is the anti-inflammatory medications. I think the public is aware that for their favorite go-to is not only aspirin, and also they are also taking steroids. The steroids may be in the form of inhalation for if you are asthmatic, or steroids if you have immune diseases, or steroids just to sometimes to boost your muscle mass production. So it can harm your microbiome. And again, one of the burdens of modern times is really we are subjected to chronic stress. Chronic stress does not only affect your heart, blood pressure, your immune system, because there is a sustained production of stress hormones. But guess what? Chronic stress, it also signals into your microbiome, the intestines, and all the rest of the immune system, where it is related to the behavior of your bad bacteria. Chronic stress can be communicated to our bad bacteria, and so it can actually promote diminution or reduction of our health. On the other hand, if you had bad bacteria in your intestines, it can also signal the so-called the gut-brain axis. Gut-brain axis, intestine to the brain. So the bad bacteria composition can also manifest itself as chronic stress. So there is a reciprocal relationship. The brain sending the signals that affect the bacteria responding in turn by producing more and more of the bad chemicals. Remember what I said earlier, the neurotransmitters. And then, of course, last but not the least in this slide is cesarean section. I don't want to be misunderstood. Cesarean sections, if done for the right reasons, especially emergency, indicated for life-saving of the baby or the mother, or both the baby and the mother, are very important. But at the same time, over the years, over the decades that OBGYN and pediatricians taking care of cesarean-born babies, they notice what? Next slide.
Dr. Joe, I
Yes.
have to say something here. I'm very curious about what you're going to say next, because for a fact that Mommy Kate had 8 children, and 6 of them were normal birth and 2 were cesarean sections. So, how does this microbiome affect or how does cesarean section affect the
Okay.
microbiome?
Actually, this is a good time to reinforce the reality, Kate, that babies born going through the mother's birth canal are at a bigger advantage. Why? Because as they travel down, their skin, their surfaces, their face actually are exposed to the health promoting bacteria of the mother's birth canal. And at the same time, inevitable that they will swallow the bacteria from the mother's birth canal. And so that actually helps promotes good and well-being and health of the baby. On the other hand, babies born by cesarean section who did not have the benefit of imbibing, swallowing, or being touched by the mother's microbiome in the birth canal will end up at a disadvantage because the kind of bacteria that they get are really the bacteria on the skin of the mother, from the operating room, etc., etc. So they are not exposed to the healthy microbiome of the mother. So what is the proof of the pudding? Well, the proof of the pudding is that when they followed the health courses of these babies, they are actually more prone to illnesses, especially allergies. Respiratory tract infections are very common, and sometimes they can observe also stunting of the growth of the babies born by cesarean section. And so, because of this progress in understanding the importance of the microbiome of the mother, if the baby needs to be born by cesarean section, what do some of the progressive OBGYN elsewhere do? What they do is, this is for the benefit of the women and the mothers. Sometimes the doctors there will actually swab the birth canal of the mother with a sterile gauze, wet it, and then swab the birth canal of the mother, and then swab that gauze into the mouth of the baby in the hope that it will populate the baby's gastrointestinal tract. So in a way of saying, it redresses the imbalance or the disadvantage of the babies by now literally feeding them with the mother's bacteria from the birth canal. And also sometimes they wipe it on the face, the skin, so that it will populate the baby's body and organs with healthy bacteria from the mother. Now, when I speak about the microbiome, I'm only talking about the gut microbiome as part of that. But remember what my definition was: it is the sum total of all the bacteria, the fungi, the viruses, and other microorganisms in the total in or in the body or on the body. And so there is a skin microbiome. There is also oral and nasal microbiome, and also the genital microbiome, referring to both males and females. So this is the sum total. So sometimes, we have a peculiar understanding of health by washing our hands, not just with soap and water, but always applying alcohol gel and whatever it is antiseptic. The stronger they are, the more disadvantaged you are. And so sometimes if you've seen the television, there is really a famous antibacterial soap that instead of believing that you are killing 99% or 90% of the bacteria, not all bacteria are disease causing. A lot of the bacteria are actually beneficial. In point in fact, if you try to point to the experience of children born in the 50s, in the 60s, where they are actually nakayapak, they don't have any sandals or shoes, and they are actually firmly grounded and playing in the mud, playing in the sand, they're actually better off. And I think that is a very important understanding that I need to emphasize tonight for the benefit of people. Sometimes you have to allow your children to get dirty. Bring them to the farm, bring them to the beach, bring them to come in contact with the soil. Because when they actually come in contact with the good soil, then they get the bacteria and trust that they're not necessarily going to be ill because of the bacteria. Because in point in fact, not all bacteria are bad, and killing all the bacteria are not necessarily beneficial. I hope it sent the message across to our friends and partners around the world.
Wow, I'm sure that message was well received by all the parents. No, that we have to allow our children to get dirty, to feel the soil, feel the water in the beach, and all of this. Dr. Joe, once the microbiome is damaged, is there a way to revert that condition? How do we improve a damaged microbiome?
Fortunately, there are many ways of helping people, patients, nonetheless, about repairing a damaged microbiome. So you have already understood bad food, medications, and everything, stress can actually damage the microbiome. Obviously, we cannot allow that to continue. And so we have to find ways by which to improve a damaged microbiome. Fortunately, science has moved progressively to understand the behavior and the dynamics of bacteria and man and humans. So the first order of the day is to remove the bad bugs. If you happen to have disease-causing bacteria, sometimes the so-called the disease-causing Escherichia coli, E. coli, or for example Salmonella, or the one responsible for typhoid, or even dysentery, amoebic dysentery, or even bacterial dysentery. So you need to treat them with antibiotics. This time, I exalt the use and the role of antibiotics because they are killing the bad bacteria. Or for example, if I have to give people, patients with antibiotics because they need this to combat an infection, so what do? I make sure that I give the antibiotics, but soon after the course of the antibiotics, I add up by giving these patients probiotics. And now that we have Kayani Probiotics Plus, rest assured that you will be in good shape, that after taking the antibiotics, replace that with the probiotics. And so the other things that you need to remove is, whenever possible and safe, is actually to remove the unnecessary use of drugs, because they can not only damage your intestines, but it can also kill the good bacteria. And last but not the least on that category of removal are the food allergens. It can be food allergens, it can be the toxin producing or carrying food, or even drinking from plasticizers or plastic bottles. These are actually something that we need to emphasize and highlight. So after you have removed it, the next step is obviously to replace. And so what do you need to replace? Well, you need to replace the needed enzymes. I mean, maybe this is a fresh understanding, because people might just take it for granted that the body is about, it produces the enzymes. That is correct. But, as we grow into our own, in our own life, and as we become more and more health challenged because of those factors that affect our health, the body is hard pressed. Your genes can only produce so much genes or enzymes, but at the same time, it can only produce it at the right amount. For example, if you are chronically depleted or weakened in your immune system, your enzyme systems are actually producing less and less of the enzymes. So you need to do that. There are actually preparations out there in the world where you can actually take enzymes. But by and large, I put, for example, add enzymes in my armamentarium or protocol in taking care of patients. And then, of course, fiber and prebiotics. Fibers are actually well understood if you talk about fruits and vegetables. My own take is colorful or rainbow-colored fruits and vegetables. Maybe I should say rainbow-colored vegetables and fruits, because I put a lot of value on the polyphenols and the protective antioxidants from vegetables that are highly colored. That, nevertheless, it is also true that it happens or is present among the fruits. But just be careful that it does not throw your blood sugar into a wild frenzy. And then, of course, the prebiotics. Maybe later on, you will learn more about the prebiotics. But at this point, prebiotics are actually plant fibers that are either digestible or indigestible for humans, but are actually definitely digestible for the bacteria. What does it do? but it may not necessarily feed you, but definitely it will provide good food for your good bacteria. And then the third step is re-inoculate. And so what do you reintroduce? Re-inoculate is simply saying to reintroduce. And what is that? Probiotics. Make sure that you deliberately introduce good bacteria by means of the probiotics. And last but not least is really repair. So your intestines, your body is in need of healing, and the healing nutrients that we have in our meats are really healthy omega-3 fatty acids. And without actually belaboring the whole issue, if you talk about the health healing nutrients called omega-3 fatty acid, what comes to your mind? Obviously, it is our sunset. And it is really one of the excellent products out there that contains omega-3 fatty acid. And then, of course, zinc. Our Probiotics Plus contains zinc, but at the same time, you can find an adequate amount of beneficial zinc in our P20 supplement. So, and to underscore the importance not just of the probiotics and the steps that about regaining a healthy microbiome, I would always put it into the following perspective. You always start with healthy food, natural foods that support the healthy microbiome, and natural foods that provide you with the basic nutrients, fat, proteins, and carbohydrates, including the micronutrients, your vegetables, the antioxidants, etc. So it starts with high polyphenols. And high polyphenols are very active, dynamic chemicals that are naturally produced and contained in colorful or rainbow-colored high-fiber fruits and vegetables. So if you talk about high polyphenols, does it work advantageously? Of course, it promotes your health. And actually, in another time, maybe we can talk more about polyphenols. But just for you to understand that if you talk about the health-promoting benefit of polyphenols and antioxidants, think Kayani Sunrise. Does it make sense? I mean, we are able to connect now. Oh, high polyphenols, you can find that in our excellent sunrise and the omega-3 fatty acid in your sunset. And then, of course, we talk about the right carbohydrates. Not all carbohydrates are the right carbohydrates. Refined sugar and highly refined sugars are actually dangerous for your health. You can take some of them occasionally, but a licentious or an excessive intake of the wrong kinds of carbohydrates will be, will probably penalize you as far as your health is concerned. So the advice is really avoid processed carbohydrates that feed bad bacteria, and it is the right carbohydrates or the so-called complex carbohydrates are the ones that feed your good bacteria. And last but not the least, your grass-fed red meat and healthy fats. And then if you talk about grass-fed red meat, you can probably, if you have a flavor or you have actually, an access to Carabao's milk or Carabao's meat, that is actually a good example of grass-fed red meat. And then healthy fats found in our ever-present coconut oil. So think virgin coconut oil made in the Philippines, olive oil, and then avocados and avocado oils, and then nuts. And then except peanuts, maybe just to emphasize, not peanut. Peanut is not a nut, but rather a legume. Okay. And so, how do we support the healthy microbiome? Well, there you go. Regular intake of probiotics, which provide multiple strains of good bacteria. It's not good to take only a single strain. You need to have multiple strains because they actually reinforce each other. And again, other than or in addition to taking the probiotics themselves, you need to have prebiotics. And what does it do? It ensures the proliferation, the growth, and the multiplication of the good bacteria. Good bacteria will die if you do not feed them. So it becomes a chancy thing. If you just say, bacteria just survive in the intestines. You have to feed them with prebiotics because prebiotics are the main source of nutrients for the good bacteria. If you want the good bacteria to help you, feed your good bacteria.
Dr. Joe, can you please share with us the difference between the prebiotics and the probiotics?
Okay, so it's another important yet simple question. Now, prebiotics to our friends, business partners, are simply plant fibers. Not simply, but its main purpose is to provide food to the good bacteria that live in the gut. So examples of the food with prebiotics are asparagus, bananas, garlic, onions, artichokes, leeks. Maybe you may not be eating this on a regular note, but think about green leafy vegetables, your saluyot, your malunggay, your kangkong. These are all food that are good with prebiotics, di ba? And then in relation, or rather in distinction, what about the probiotics? Let me define that again. Living microorganisms that add to the good bacteria in your gut. So there are foods with probiotics, and these are actually naturally fermented food. You have the yogurt. Just be careful that you are not eating or taking in processed yogurt. So there are many out there, there are many natural. So you make sure that these are naturally fermented and not the processed yogurt. And I will not advertise any names. And then the kefir. So what is kefir? Kefir is actually just a fermentation of milk. So for example, if you have Carabao's milk, there are some actually cultures out there in the healthy food stores that, that they call it as their inoculum, meaning to say, you put this bacteria inoculum in the milk, allow it to stand at room temperature, and you produce sour milk or fermented milk, and that is good. And then of course sauerkraut. And if you Google search what is sauerkraut, you find out that it is actually pickled cabbage. Very, very common among the Germanic nations. No? Germany.
German. Yeah.
And then of course, who cannot not develop an appreciation, whether you like kimchi or not, it is one of those healthy foods. And then kombucha. Kombucha is actually fermented. There is an inoculum of lactobacilli that you put in tea that becomes kombucha, fermented tea. Miso is very common among the Japanese because it is fermented soy, and soy is also tempeh in some other Asian countries. That's all fermented soy. Okay? So if you remember all of these things, you realize that food can be a good instrument for actually promoting good bacteria.
Okay, Dr. Joe, let's talk some more about probiotics, please. Let's focus on that one.
And since tonight is our night of date with probiotics, or to understand how probiotics promote health, simply said, probiotics are strains, multiple strains to be exact, of beneficial bacteria that promotes the health of the host. So if you feed your body, your intestines in particular, with good bacteria, your good bacteria will help you. And the health benefits. So the truth of the matter is that when you take them in, and if they survive the passage through the gastrointestinal tract, they will remain very, very plentiful, not only in your small intestine, especially the distal or the farther down portion of the small intestine, and mainly in your large intestine. And so this is where you form your waste matter that is actually going to be evacuated every single day. By the way, if you have problem evacuating your colon, your intestine every day, I think you go to your doctor to help you out. And because if you are constipated and you don't move your bowel every single day, you have a problem, because you are actually allowing decaying matter inside your intestine. Is not good. It is just allowing them to you are storing actually bad materials inside your body. So, and then improve the absorption of food nutrients. Probiotics are very notable because it's not only what you eat. Remember, people say, you are what you eat, but it is you are what you absorb from what you eat. So not everything that we eat are absorbed. And so to guarantee that you absorb the right amount of nutrients, the answer is have good bacteria in your intestines. Good bacteria inevitably will support your immune health, because 70% of our immunity resides in the intestines, and it also helps blocks disease-causing bacteria. So it's just a matter of, if there are more good bacteria, they crowd out the bad bacteria. And at the same time, good bacteria end up killing this disease-causing bacteria, because there are strains, particularly the lactobacilli, that produce hydrogen peroxide that is lethal to the disease-causing bacteria. And last but not the least, whether you like it or not, but it does work, prevents absorption of toxins in the body. So where do you get the toxins in the body? Primarily from what we eat, what we put on our body, or what we inhale, or even, when you drink from plastic bottles, there are actually toxins out there. There are thousands upon thousands of toxins in the body. And so obviously, one simple way is that your body with good bacteria in your intestines will promote detoxification by removal of the toxins in the body. It's simple, and yet it sent about a powerful message of what probiotics can do for us.
Dr. Joe, what are the best sources of probiotics?
Thank you for that question, Kate. Actually, food is always your number one go-to. And of the food, make sure that you are taking or eating lactic acid fermented food. It is called lactic acid because historically it's been proven that lactic acid beneficially ferments food. Of course, there are other bacterial strains like bifidobacterium, but that which is actually contained in our probiotics plus. But just the same, if you talk about lactic acid fermented, another way of looking at it is they're naturally fermented. So, people in the olden times, because they cannot, do not have refrigerators, end up eating or drinking sour milk, and only to discover that by accident that it is beneficial for their health. Okay, and then lactic acid fermented food, and we have mentioned that kimchi, sauerkraut, etc. And then of course on the other side, if you cannot have access to fermented food, so what is your next go-to? Probiotics. And of all the probiotics, I would probably say I highlight our own Kayani Probiotics Plus.
Wonderful. And Dr. Joe, can you please share with us the benefits of taking probiotics?
Okay, there are so many. And, this slide, if you take the time to even take a picture of this slide from your screen, it will be good for you to understand. But let me focus on the left side, because to me, everything is important and everything is actually beneficial. But I would like to focus on the left side because to me, these are the top of mind benefits. No, overall digestion. You have understood that already. Bloating, gaseousness, constipation, diarrhea is actually more often than not presence of bad bacteria or combination or imbalance of good versus bad or bad versus good bacteria. And so when you take in probiotics, you redress the imbalance and shift that towards good digestion. And then we already learned that good bacteria or your probiotics promote absorption of vitamin and nutrient absorption. And so to ensure health, it's not only so much about taking multivitamins or even nutrients, fat, proteins, and carbohydrate, and the other micronutrients. Very important that it has to be understood that you need to have health promoting good bacteria inside your intestines. So actually to maximize the benefit. And it also helps maintain healthy cholesterol. It may come as a surprise to you, but taking good probiotics and creating balance inside your intestines will help assure healthy cholesterol levels without taking medications like statins. And how does it do this? Well, you know that when you eat bad fat, it stays in your intestines and then actually can become absorbed. So what your body does is that it produces bile acids, and bile acids are able to cut down digestive fat and actually allow that to go into your intestines and to be moved out when you move your bowel. So the net effect is that you have maintained excess cholesterol is actually put out by your bowel movement, and therefore at healthy levels. And then you might be surprised, how does probiotics regulate hormone levels? Here I would like to emphasize only 2 or even 3 hormones: insulin, cortisol or steroid, at the same time estrogen and other reproductive hormones. When you have the, for example, imbalances, especially insulin, if you are taking in a lot of blood sugar and
Recording in progress.
where do you get your estrogen? A lot of times it can be the imbalance, and maybe you may not know this, but you have actually meat that are actually estrogen laden, and also there are also other products that we accidentally or unknowingly take in. We call that the xenoestrogens. So xenoestrogens produce estrogen-like effect. But what your bacteria, good bacteria, does is that split it open. It splits it so that the bad element of that xenoestrogen are actually facilitated and removed when you move your bowels. And ultimately, your probiotics can also actually produce enzymatic effect so that you restore the estrogen level. It's a little complex, but just for you to know that hormone levels are actually helped by taking probiotics. And of course, you already know that 70% of our immune system is there in our gastrointestinal tract, and then help maintain your weight. How do you maintain your weight? Again, removing excess fat, excess sugar, and at the same time, when you have better absorption of your nutrients and vitamins, you can actually already help regain your weight. Increase longevity and energy. It's been discovered now that your good bacteria, particularly the lactobacilli, can actually increase the substance called interferon. What is interferon? Actually, it has some antibacterial effect, but at the same time, your good bacteria has a benefit of also making sure that the absorption of nutrients, and also by eating a lot of healthy vegetables and fermented food, and it contributes to longevity because it has effect on their genetic expressions. And last but not the least on this one is reduce the frequency of yeast and urinary tract infection. So I thought antibiotics would be the best. Yes, a dedicated prescription of antibiotics taken for the right reason and the right amount will be good. But on the other hand, I have seen patients, especially among the females, the elderly, and those who have had several births already, who are actually have a tendency to develop recurrent urinary tract infection. So the way I treat them is that you treat them with antibiotics based on a sensitivity testing of the bacteria, and at the same time making sure that they use that they have probiotics, because this one helps maintain the good bacterial composition of your intestinal bacteria. And at the same time, that females with recurrent urinary tract infection inevitably or commonly get the bacterial infection from their bacteria from the intestines. So colonic bacteria are the ones that are causing urinary tract infection. And then last but not the least, if you take a look on the right side, it says there, mood and stress-related digestive symptoms. I made mention about the neurotransmitters, and then also preventing sore throat, sinus infection, and ear infection. So you might wonder, how do you do that? Very simple. If you know that our Probiotics Plus comes in powdered form, so when you are ready to take that first thing in the morning, what you do is you cut it open or rip it open, and then some of them, some of us will end up putting it directly, the powdered granules on your mouth, and it tastes very good. It is really like it's slightly sour, but it has a pleasant taste. And at the same time, what I do is I tell them, if you want to, and this is something that I would encourage, get a small amount of water in a glass, pour the contents of the pouch or the sachet, mix it thoroughly, and then drink it. But before drinking the whole thing, what you need to do is take a swig, swish it in your mouth, 1 minute, or even gargle it. Why do you want to gargle it and then swallow it? Don't be very finicky about the whole thing, because it goes into your intestines anyway. So when you gargle it, you allow contact of the probiotics in the Probiotics Plus sachet that has now been dissolved in water, and it allows it a wider and a longer contact with the linings of your throat. And from the throat, actually, it can migrate up to your nose. And guess what? It actually improves your resistance to viral infection, because you have now populated it with good bacteria. So now you have learned another dimension to taking care of your throat and prevent recurrent throat infections.
Dr. Joel, take a look at the contents of our Probiotics Plus. What can you say about this?
If I look at all of these things and with what I know about prebiotics and probiotics, I would say this is a good spread. And I think this is something that we can and should encourage taking. Not only that probiotics are very good, but if I take a look at all of these things, it has the probiotics, prebiotics. These are the food, the fibers. Some of them are actually the so-called indigestible fibers, but all of them are fibers that the good bacteria you can use as food. No, the byproduct of digesting this is called the so-called butyrate. So this is a short-chain fatty acid. But let me not go too deep on that. But if you take a look at the compositions that will actually reside in the small and large intestine, these are to me the most important or the more important of the strains and the genus of the bacteria that are health promoting. The lactobacilli, especially acidophilus and casei and plantarum, all for that matter. And then the bifidobacteria, bifidobacterium lactis, bifidobacterium longum, especially beneficial for the women out there. And this is 50% of our crowd are really women. Take note that bifidobacterium brevi will promote actually health of your genital tract. And then last but not the least is the Streptococcus thermophilus. It's another beneficial. So what I like with our Probiotics Plus is that they have actually mixed this various strains of good and healthy promoting bacteria in the right amount. Some bacteria, some probiotic preparation may have 10,000, 5,000, 50,000, or even 100,000. But it's not so much about the amount, but take a look at the proportion of the strains of bacteria. The more strains of good health-promoting bacteria or probiotics, the better. So it is both amount or concentration of bacteria as much as the number of strains of bacteria that determines the effectiveness of your probiotics. But most important is really in the next slide. Okay, in the next slide is that our product, Kayani Probiotics Plus, has a long history of safe use, especially from its country of origin, which you know now to be Korea. It's been there for quite a while, and they are actually one of the leading countries that produce good probiotics, aside from the fact that it's a country of origin for our ever-present kimchi. Now, our Kayani Probiotics Plus is one of those brands that is well suited for intestinal survival. So it's not only so much that you have many, many billions of bacteria and also several strains of bacteria in your preparation or commercial preparation. Make sure that the bacteria you're taking will survive passage through the intestines, to the stomach, acid, and also the enzymes in the upper small intestine, because it doesn't make sense if you drink all of these things and they arrive dead in the small and large intestine. It doesn't improve anything. It just actually provides you excess dead cells. So make sure that your probiotics survive, and our Kayani probiotics are just really designed and planned so that it will survive the passage. And then finally, or second to the last, is that it benefits by inhibiting common toxic pathogen. And remember what I said, when you crowd out the bad bacteria and you try to populate your intestines with good bacteria, then actually it can ensure and protect you from future infections. In point of fact, some of you may have had the so-called traveler's diarrhea. Does it sound familiar to you? So when you travel from place to place and you inadvertently eat something or drink something that may cause you diarrhea, make sure that you have Kayani Probiotics Plus. And then, of course, the beneficial modulation of the immune system is very important for us to repeat that, because in this time and age when we are on the lockdown, a healthy immune system is a very important thing. Now, I would like to relate to you a story, because I came across this and I was really impressed by the power of the probiotics. There was one a specialist, and in gut health and functional medicine and that. When he was asked, in one of the webinar that he conducted, he was asked this question: if you are to bring with you a supplement and you happen to be stranded in a remote island, what would your choice be? And without blinking and without batting an eyelash, what did he say? Probiotics. And now, couple that with what we know to be a good product, Kayani Probiotics, I think you are in for a very exciting ride.
Wow, that's very interesting. Sabi nung doctor, if he was stranded in a remote island, the product he will choose to be with him will be the probiotics. Dr. Joe, but we have more than the probiotics in Kayani. We have the triangle of health, right? So
Yes,
what is
yes.
the power of combining the probiotics with our triangle of health?
So earlier in this discussion, I made mention of the fact that how to replace a good microbiome with a bad microbiome with a good microbiome. So remember, I mentioned about remove, repair, replace, and then of course try to repair the intestines. No? And so I did mention about omega-3 fatty acids. So it comes as a natural uh, protective and additive complementing supplement that you have from Probiotics Plus, and you have the benefit of wild Alaskan blue salmon. Okay, this is you find that of course in your sunset, and of course coupled with the fact that how one way to repair your damaged microbiome or damaged intestine is the zinc, and you find zinc in our Probiotics Plus as well as in our Fit 20. The other thing that I find simply exciting, but at the same time also one way that will open the minds of our business partners and friends is that you remembered about health promotion with the healthy polyphenols together with your probiotics. And so if you talk about polyphenols, think what? Think Kayani Sunrise. And of course, everybody hands down will accept the power and the usefulness of Nitro Extreme because it not only dilates your blood vessels, but also helps assure the absorption and utilization of the nutrients that are absorbed with the help of the Triangle of Health and also our Kayani Probiotics Plus. So you are again, you are an advantage. Even if you are not doctors, you can understand the power of good nutrition and good supplements, and you have it in our Kayani Triangle of Health. And at the same time, now that we have the Kayani Probiotics Plus.
Dr. Joe, thank you for tying together the power of our triangle of health with our protein products and the probiotics plus. I'm just looking at the chat box and I'd like to acknowledge Sarah Halog, who's joining us all the way from the Bay Area. It's 5:20 a.m. in the morning there. Thank you for joining us so early in the morning, Sarah. We also have a comment here from one of our healthy living experts, si Dr. Vanji Cortez. Sabi niya, thank you, Dr. Joe, for a very instructive talk. Same message was echoed by Susan Maresigan. It is a very comprehensive, talagang napakalawak at napakalalim ng discussion ni Dr. Joe tonight with us. So we will now proceed, Dr. Joe, to our Q&A portion. Again, I'd like to remind everyone that Kayani products are not medication and are not intended to diagnose, treat, cure, or prevent any disease or medical condition. So, Dr. Joe, I saw a question here earlier about does our Probiotics Plus help those having acute diarrhea or LBM? Can I just say something here, Dr. Joe, before you respond to this? No, because I've shared with you my experience. Alam niyo po, si Mami Kate, I had, when I had my first jab, the first dose of the Pfizer vaccine, I did not feel any body aches and pains. I didn't have fever. What happened to me was like 2 days after the injection, I had diarrhea, really bad diarrhea, as in watery stool and all that, no? And then, of course, I was taking our Triangle of Health, so I didn't feel weak. But I still kept moving. What I did was, I remember the Probiotics Plus and I took it at that time. And Dr. Joe, it was like magic for me because what I felt was, it made my tummy quiet. Nawala yung pag-ikot-ikot ng tiyan. It was very gassy, that nauseous feeling, it went away. So what do you think happened there? I think no, it addressed the situation.
Yeah, actually, we experience this, very often. Sometimes it can be bad food, so happens to be incidental, and at the same time, any imbalances with the functions in the intestines can create an imbalance. Sometimes, it can be a product of not only something that you have ingested, but sometimes it is also the release of toxins in the body that goes into your intestine promoting diarrhea. But let me be specific about it. By actually taking your supplement, your recommended probiotics plus, in this instance, if you have probably diarrhea, I will not hesitate to tell you, you can add a total of perhaps 2 or 3 sachets of probiotics, because there are some preparations that are high as 50,000 or even 100,000 bacteria. They call it CFU, colony forming units. No? So that's how you count the bacterial composition of the product. But as I said, it's not so much about the numbers, but also the ability to survive the passage of the acidic stomach and also the very alkaline upper gastrointestinal tract or upper intestine. But here, when you start already promoting good bacteria, it already starts the power of healing because it actually crowds out the bad bacteria. So when you start repopulating your intestines with good bacteria, it's almost like, the effect is very, very quick. It may not be instantaneous, but it can be very quick. That is why one of my go-to, if I'm taking care of patients with diarrhea, especially those who have been taking a lot of antibiotics, or for example, after they've taken the antibiotics, or because they have been taking antibiotics for so long, you just feed them a lot of probiotics, and it will actually heal and reverse itself in a short while.
So what you're saying, Dr. Joe, is if we have a severe case of diarrhea, because we have the probiotics plus in a pouch, no? We
Yeah.
can take like 2 or 3, not just one.
Sure.
We can.
And then just like, for example, anytime that you have diarrhea, remember that you lose fluid. So it might be an idea that you put this in water or even hydride. For example, if you want to replace your electrolyte, there are actually electrolyte powder solution. You dilute that and you add your probiotics and you just take it. So it is in 1 glass of water you have the electrolyte replacement and you have also the probiotics. And so 2 birds with 1 stone.
Okay, wonderful. Here's a question from Sefrine Tikis. Good evening, Dr. Joe. When is the best time to take the probiotics plus? What's the best sequence? So she's asking about the time and then the sequence in taking the Triangle of Health, because she takes the Triangle of Health, good for you, Sefrine, the HL5, and then now she's adding the probiotics plus. So what is the right sequence? Yun ho ang tanong niya.
The way I do it is, been born by, my own readings. And so the first thing that I take before I even take, for example, you can take your Nitro Extreme. Okay, so
Nitro Extreme first.
Nitro Extreme. Then you can actually take your probiotics. Now that we have the probiotics, it will also be good to do that. So you just allow some, a span of, few minutes, maybe 10 to 15 minutes between your Kayani Sunrise, or rather Nitro Extreme, and then your probiotic. And then you can take your Sunrise.
Okay.
And then, of course, you have your breakfast, or if you are doing intermittent fasting, you can delay that. But again, you have already benefited from it. Then the other thing about taking that before is really you allow already the opportunity to mix with the intestinal contents, and so that's the best time to populate your intestines.
Dr. Joe, thank you for that. No, Rina has a question here. Can the probiotics plus be taken first by diabetics and second by children?
Oh yeah. Well, actually, remember that there's a product called, by pediatricians. I will not mention the commercial name because I might be guilty of of promoting some other preparation. But in point in fact, if children are actually taking that probiotic, which is actually what I think one or two or three strains, but ours is 7. Like in the same way that you are feeding your children with that liquid probiotics made by another pharmaceutical company, you can actually do the same with our sachet. So don't be worried. So if the child is about 5 years old or thereabouts, you can actually estimate. You can just split the sachet content, give it in a little water, and then let the child drink it. And then, of course, you can take it actually as an adult. Maybe they recommend it as a maintenance is 1 sachet. But if there is a condition like a diarrhea or some other infection that you have, especially from prolonged antibiotic use, you can take 2 or 3 until you fix your gut, your intestines.
So our probiotics can be taken by children 12 and above. But what you're saying is for little children is to just give them a small dose.
Just give them a proportion, especially if they have diarrhea, because because the tendency for children to have diarrhea is markedly less, especially if they are normally spontaneous delivery, because they have already imbibed the mother's probiotic, the mother's bacterial composition. So that will be the way I'd like to see it.
Okay. Dr. Joe, thank you for that reply. We have a question here from Efren Remando. Can a person with diverticulitis take the prebiotics plus? And if yes, how often? Right. How often?
If the patient has diverticulitis, I take it to mean that this is acute. So if this is acute, you fix it first, no?
Dr. Joe, I think you have to explain to the lay people what does diverticulitis mean.
Okay.
Ako alam ko yun kasi I have a friend suffering from that.
Right.
No?
Okay, thank you for reminding me, Kate. So let me lay down the predicate. The predicate being, if whoever asked that question, or for example, familiar with this, and if you are a person who is not moving your bowels every day, so you do it every other day or every 3 days or once a week, watch out. You may be a candidate for diverticulum or diverticulitis. And diverticulum is an outpouching because if you are chronically constipated, there is such a thing as a response of the intestines where because you're straining that, there's an outpouching, meaning to say one of the linings just pops out as an outpouching, it goes out of the wall and it is really very thin. Now, what happens is that if it becomes infected or inflamed, we call it diverticulitis. But the common denominator in why people develop diverticulitis is chronic constipation. And chronic constipation can be experienced by people who have probably an imbalanced microbiome. So one way to protect yourself is that you take healthy probiotics. Our probiotics plus will be a step in the right direction.
Okay, Doc. Earlier pala in that question, you forgot to address the query about people who have diabetes.
Oh yeah. Thanks for reminding me.
Can the probiotics plus help them?
Yeah, actually, I made mention of the fact that diabetics can be helped by probiotics plus because it actually promotes metabolism of sugar, especially if you are willing to take care of your diabetes and you cut down on your sugar, because it will not probably be it will probably not be something like presumptive of me to say, now, if you want to take care of your diabetes, don't take only probiotics. Cut down your sugar. Okay,
there you go. Right.
Cut down your sugar, and then you allow your probiotics to work. Then it can actually benefit. It can actually benefit you because many benefit from taking the probiotics. If you are diabetic, it can help you maintain weight. If you cut down on your sugar, you take probiotics, there will be actually an important effect because you have better digestion, you are better able to absorb your nutrients, and together with the prebiotic in probiotics plus, actually it produces a lot of good secretions for the bacteria called the butyric acid, butyrates, and that will actually also help mitigate in diabetes. And so if you have better absorption of your nutrients, and it is better able to do that. And then, of course, I mentioned also about the benefit of probiotics in terms of maintaining hormone level. It can also have the benefit of helping restore sensitivity to insulin, because many people, many diabetics, have insulin resistance. And so by taking on probiotics, it can actually help restore, especially if you cut down on sugar on your diet, it can help restore insulin sensitivity. And the doctors out there will understand that people with insulin resistance are actually prone to diabetes. And many diabetics who refuse to be treated are actually, they remain insulin resistant. So one way to do that, help your body take care of, cut down on excess sugar. And at the same time, what do? Add probiotics.
Wonderful. Dr. Joe, may comment si Lisbeth. Ang galing ni Dr. Joe, very informative. Let's now go to a question by Donna Ligo Mendoza. What about for patients who are wheelchair bound or with limited mobility and only move their bowel every other day? Can the probiotics plus help?
Oh yeah, definitely. Definitely, because remember that bacteria, the good bacteria, have a way of actually of producing acetylcholine. Before I forget, this is one of the benefits of the probiotics. It actually produces the manufacture of a substance, a transmitter, a neurotransmitter called acetylcholine. Of course, I may be going a little above, about the common.
Technical na yan, no?
Medyo mabigat. Pero just to answer the question, will it help people who are wheelchair bound or highly not really mobile to move their bowels? And the answer is yes, provided they are not paralyzed because of stroke, but because they are not moving their bowels, because they are not moving about. The presence of the good bacteria plus the probiotics will ensure that there is a substance that can be manufactured, and we call that the acetylcholine. And it actually helps move the intestinal muscles to eject the stools.
Okay. Dr. Joe, there is someone here who was asking, can probiotics be mixed in warm or hot water? Ito po tinanong ko sa Korea, no? Sabi nila hindi daw po. You have to just take it with room temperature water.
Yes.
Ideally.
Because obviously, if you put that in hot water, it will kill the bacteria.
Correct.
The bacteria. So the good rule of thumb is the following. Room temperature will be good.
Yes. And so then, Dr. Joe.
Yes, and it is an assurance that you will be absorbing the bacteria in almost the same as advertised as 10,000 CFUs or 10 billion CFUs.
There's a question here from someone who just underwent an angioplasty. This is more like your turf.
Yep.
Can this person benefit from taking the triangle of health and the probiotics plus?
Yes.
Yan. Okay.
Very important that if you are journeying towards health and wellness, you have actually done the intervention. So they can say, we have fixed your obstruction in the coronary artery. Support your journey towards health by taking the Kayani triangle of health and the probiotics plus.
How about for babies, Dr. Joe? If we can give our babies a little bit of the probiotics plus and mix it with milk, pwede na ba ang babies?
There is really no hard and fast rules, Kate. But if I use, for example, what we have learned about pediatricians giving babies probiotics, so I don't see any reason why you cannot put your probiotics plus in a little amount of milk, whether it's a mother's milk or cow's milk.
Formula, milk formula.
And then put it in the, allow the baby to drink it.
Okay. I'm just reading the reply of our customer service manager, Weng Guevara, because there are many asking how much is the Probiotics Plus. Magko-commercial muna ako saglit, Dr. Joe, no? The Probiotics Plus is at 2,300 per box of 30 pouches, no? 30 pouches po ang laman every box. And for the month of July, we have a special launch promo where you can buy 2 boxes of Probiotics Plus at 4,600 and you get a free Nitro Extreme 56 ml. That's a real big deal, no? So there you have it. Dr. Joe, babalik po tayo. Can Probiotics Plus help a colon cancer patient?
Okay, all right. Let me qualify my answer. If you
Yes.
talk about will it help the colon patient cancer, of course yes. But my advice is that you have to get that colonic cancer fixed. So, okay, whether you do it by surgery, by photocoagulation, or by chemotherapy. That's very important that you address that. And of course, there are other things that you can do. Sometimes people will resort to natural therapy, but I have to caution you that you have to be particularly informed what are you going into. But the simple question that can it help colonic cancer patient? The answer is really yes. In point in fact, maybe I would like to point the discussion years and years or even decades forward before the person referred to has developed cancer of the intestines. You know what? If you were just taking care of cutting down on your sugar and taking these probiotics, including high fiber diet, you would actually be able to avoid colonic cancer. And also at the same time, something very simple and yet straightforward in its impact is that if, for example, you are a person with chronic constipation, you may not necessarily have cancer, but that is actually a situation where eventually, because of the prolonged contact of the stools inside the intestines, it can have a carcinogenic effect on the lining of the colon. So very important that people move their bowel. So if they are actually moving their bowel 2 or 3 times a day, rejoice, because that is actually, you don't get stuck up with the waste matter.
Okay, Dr. Joe, there's a question here from Mohammed. He said, can the specific strains of bacteria in the probiotics overgrow in the intestine and negatively affect the growth of other beneficial bacteria?
Well, not
Is there
really.
such a thing?
Actually, in my readings and my own experience, this is what I do. In the reference that I came across, it said, "How long will you be taking probiotics?" And the answer is continuous. Continuous. Why? Because you see, the lining of the intestines are replaced every 3 days without you knowing. Every 3 days, the lining of the intestines can become damaged by what we eat and what happens to the intestines. But it is actually replaced every 3 days. And so, to that question that it can help with probiotics, the answer is really yes. That is why what I do, for example, just to be for example, straightforward about the whole thing. So what I do is, for example, there is Kayani Probiotics Plus. But sometimes I will probably cycle it. After 3 months, I will probably add another probiotics and then go back to Kayani Probiotics Plus. Because you want to make sure that there is a continuing replacement of different strains of probiotics.
Okay. All right. Dr. Joe, I just want to clarify the price that I mentioned tonight for the Probiotics Plus is the price only for business partners of Kayani. That is not the customer price. Okay? So the customer price is higher. The price that Mami Kate and Miss Weng mentioned in the chat box the price is only for the business partners. Okay. Last question.
Kate,
Yeah.
Actually, your promo is good because you know you're giving sending across probiotics plus and also Kayani Nitro Extreme.
Yeah, thank you, Dr. Joe. Alam ko kasi Nitro diehard ka rin, no? Okay. Dr. Joe, we have so many questions, but, you can reach Dr. Joe. I'll ask Rio now to please flash the email address and the mobile number of Dr. Joe for those who want to do private consultations with him. But before we go, Dr. Joe, just one final question. Can the probiotics plus be taken by a pregnant woman, especially if she has gestational diabetes?
I would say hands down yes. First, because of its benefit to diabetes, right?
Yeah.
And then at
Okay.
the same time, if you are a pregnant mother, even if you are not yet nearing your delivery time, you are actually helping your intestine to be populated with good, healthy, health-promoting bacteria. And you can find that in our probiotics plus.
Okay, so hands down, Dr. Joe said yes, definitely our probiotics plus can help a pregnant woman who has gestational diabetes. So for those of you whose questions were not answered tonight, I would like to ask you to, feel free to email Dr. Joe or send him a text message. Those who want to do private consultations, you are most welcome to do that. Dr. Joe, we had a very informative and enlightening discussion tonight. I think the audience will agree with me because these are the messages that we're getting on the chat box. And we are very grateful to you for making it so simple and easy for us to understand complex medical ideas and terms. So there you have it, dear friends, no? Our new product, the Probiotics Plus, and how beautifully Dr. Joe explained to us that together with the Triangle of Health, it can really benefit our health and at the same time promote a stronger, more resilient immune system for all of us. Dr. Joe, before I let you go tonight, may I request you to please give us a final message?
The final message is the following. As a physician, I have learned a few years back when I started incorporating functional medicine that it has become a standard go-to for me to have a probiotics in addition to the other supplements, and of which now I actually encourage my patient to take on Kayani Triangle of Health. It's really the probiotics because of all the obvious health benefit. And even if you're struggling with cancer, you're struggling with diabetes, hypertension, and even patients, for example, with other medical histories, autoimmune disease, you're one of your almost like one of your standard go-to is the probiotics. So this is actually my own parting message to each and every one of you is that you'll never go wrong by taking with you probiotics. When you travel, when you maintain your health, always remember to have probiotics not too far from your access.
Thank you so much, Dr. Joe. And it is our honor and our pleasure to have you with us tonight. No, we learned much from you. My dear friends, we need to take charge of our health and our lives today. This is what our healthy living experts would always tell us. And as we can see from Dr. Joe, healthy living is more than just taking our Kayani food supplements. Healthy living is really a way of life. And it's about the choices that we make every single day. And this will determine, the kind of health that we will all have. So my advice to all of you, please eat healthy, sleep well, exercise regularly, keep yourself hydrated with lots of water, and take your Kayani food supplements every day. Keep your gut healthy with our Probiotics Plus. Okay, this is what we learned tonight. So order your probiotics now. And on top of all of these healthy living practices, please don't forget to pray. And most of all, love much. It has been such an exciting GM's hour. Thank you for staying with us until the end. We hope you enjoyed every minute of it as much as we enjoyed putting this together for you. We will see you again next Friday, that's July 23 at 8 p.m. for our July Leaders Night with the theme All In. So mark your calendars for that important date. Have a beautiful weekend, everyone. When the final song is played, please take time to post in the chat box all your messages of gratitude to Dr. Joe, appreciation for what you heard tonight, and messages of inspiration for one another. Let's continue to stay connected, live Kayani, and share the gift of Kayani to others. Stay safe, stay healthy, stay tuned to Kayani Philippines. This is GM Kate Belusilio reminding you we are Kayani Hope Givers. Arigato in, arigato out. Thank you and good night.